I was admitted knowing that I had dengue fever because the symptoms were all about dengue. High fever, rash. I did not have any idea that I had cancer. When I was admitted, I was taken into the hematology ward. That's when it struck me that it must be something more than dengue. The doctor who was treating me, he said, this is treatable. You are detected at a very early stage. So I thought, okay, fine. I sort of came out of that mindset, get myself ready and go back for a long 6-7 month stay. That's when I realized my world might just end.
The treatments for leukemias have changed dramatically over the last 10 to 15 years. These days, there are a lot more new treatment options and they are able to provide a much better chance of cure with lesser side effects. Some of these are targeted therapy, checkpoint inhibitors, immunotherapy, and specialized cellular therapy like CAR T-cell therapy. The success rate really depends on a few factors like the age of patient, type of leukemia, the general health of the patient, and of course the treatment choices available. For example, a young patient who has got no other medical problems, the chance of a cure can be as high as 70-80%. Like an old patient who is 70-80 years old and with other medical problems like strokes or heart problems, the chance of a cure is less than 5-10%.
Nazmur and I have been a long friend over 33 years. When Nazmur had discovered his cancer, we were all taken back. Most of the patients in Bangladesh I've seen in my career are coming up with differential diagnosis about cancer treatment. So my role here is to connect and also help them understand that which particular facilities should be relevant and which particular doctor for his specific treatment. Also financial counseling about the treatment. We try to take away their worries so that they can spend more quality time with the patient.
I was about to have my A-level exam. I actually deferred going to college for a year just so that I could, spend time with him, because for all you have known, that could have been my last year. There were times we had to go to the hospital at like 3-4 in the morning. I was always there to ensure that he was taken care of. I'm just glad that he's cancer-free and he can now use the time which he has to service other people and make this world a better place as well.
I thought, I survived cancer for a reason, and the reason was to do good for the human beings, creating a change for the cancer patients who cannot afford good treatment. So that indulged me into actually going into Bangladesh Cancer Aid Foundation. I feel different. I feel more deeply for people.